Are you a new nursing student or you've been in nursing school for a while, but unfortunately you are still struggling with your exams, studying adequately for them? Well, I am here today to help you with 7 innovative studying strategies that can help you prepare adequately for those exams so you can smash them. All right? Hi, welcome back to my YouTube channel. My name is Esther E.L.V.A. I am a nurse educator with a master's degree in nursing education. I am super passionate about educating future nurses, okay? I believe that knowledge is active. You don't stumble into knowledge, you need to actively pursue it. And it's not of much use to you if you don't apply it actively. So I'm here to help you to acquire knowledge in nursing and to use it ultimately. All right? So today, without further ado, let us jump right into today's video. All right, so my number 1 studying strategy for you is you need to set aside time. You need to have a studying schedule and you need to have a time for that. I know that a lot of your nursing students are working. You are really busy, all right, with a lot on your hands, but you are here. You are in nursing school because you want to be a nurse, and you cannot have that as the very last thing on your plate, okay? You need to set time for it. At least you need an hour to 2 each day to study. Outside of your school hours, you need time each day to study. Very important. Set that time, stick to it. Once the alarm rings, go do it. All right. I spoke to one of my students today and she said, Miss Esther, when my alarm rings for studying, I go ahead. Like, I don't let anything get into that in between that. That's what you need to do. You need such energy and consistency. Again, like I said earlier, knowledge is active. It requires intentionality and you're actively going after this. All right. Number two, you need to figure out what your learning style is. All right, a lot of us learn in so many different ways. You could be a visual learner, an auditory learner, a kinetic learner, which is maybe a tactile. All right, so I will put in the description box a learning style test that you can take to figure out what exactly your learning style is if you don't already know that. Okay, so when you know that, it helps you to optimize how you learn. So for example, if you are a visual learner, you probably do best for looking at pictures, watching videos, all right, looking at things. Versus you're an auditory learner, you do better with listening in class. You're the one who really want to pay attention in class the most. You want to listen to audios on the go. All right, so you need to know what is best for you. That will make you tailor your learning to how optimal you learn. And then number 3, what I want you to do after your teacher is done teaching you in class is whatever PowerPoint or however your teacher teach, most often time you have a textbook, all right, that you are required to read. And a lot of things are going to come out from that textbook. So what I want you to do is set like an hour down. And I know if you're in nursing school, you know that some of these chapters are a lot. Like one chapter could be about 30 pages. Yep, I know. So what I want you to do is set a time down, okay, and go through that 30 pages, maybe in an hour or 2. And what are you doing? This will be the very first time you will read it through that chapter. All right, just read through the chapter. And what you do is have a paper or a book close to you or highlighter. Highlight the things that you feel like this is definitely important. It makes sense to me because your teacher has talked about it before, or you can even do this before the teacher teaches that chapter so that when you go to class, that is like double learning right there. Your teacher is adding more context, adding more understanding. You even know what questions to ask because you've done some learning beforehand. All right, so what you do is you highlight the important things or you write them down in your book. Better to, if you're like me, flashcards. Okay, when you write those things down, now you don't have to go back to that textbook most often time because you've picked out, not only have you gotten a general understanding of the entire chapter, but you've also picked out the key points that you will then continue to review and review and review over and over again. All right. So number 4, write out those key points in flashcards. I love flashcards as opposed to books, okay? Because the thing is, when it comes to notes or you having a notebook that you write those things in, it can get very, just jumbled up at times. You're like, oh my God, that's a lot of things on that paper. Where do I even start from? And sometimes when you're even writing these things, you're writing so fast, your handwriting doesn't look so good, and it can still look very tasking. So if you go to the store, go to whatever store close to you, go to Amazon, you can order flashcards, all right? And I love them because they are much smaller papers that I can just write key points on. You can go to Amazon or any of the stores and get a flashcard. They are also called index cards. So they look like this. There's so many sizes, so it can be this small, and it could be, this is another size, and this is like one of the biggest size, I believe. And they come in different colors, so it doesn't even have to be white. If you like pink, purple, have fun with this thing, okay? I know a lot of you might have to do like your pharmacology medications on there for clinicals, but you don't have to use it for just pharmacology. You can use it for so many other things: fundamental, med surg, mental health, maximize the need. And another good benefits to your flashcard is that you can have them on the go. All right. When I was studying for my NCLEX, I would literally have them with me, and I would have like med surg flashcards, pharmacology flashcard, fundamental flashcard, and I would use rubber bands and band them up and put them in Ziploc bag and carry them around with me. So everywhere I go, if I want to review fundamentals, I would just pull out that bunch and review it. Okay, so do this thing. When you're at work, some of you work, maybe you work night shift, you can bring out one bunch of flashcards. I want to review pulmonary edema. I want to review this one. You can put it up and start reading and reviewing right where you are, as opposed to maybe carrying out around a notebook or carrying around your entire textbook. My fifth strategy for you is record yourself. So for those of you who are visual learners, flashcards might be good for you, but if you are more of an auditory learner, recording yourself could actually be a very good thing. You might say, what do you mean by that? Everyone has a phone, most likely, and you have an app on there that says voice recorder, right? So what you need to do is anytime you read something, or even after you've taken your notes and stuff, you can press record and kind of just explain it to yourself while recording it. Okay, just read it out to yourself, explain it. So like, all right, so pulmonary edema is when there's fluid in the lungs, and these are the symptoms you see: frothy pink sputum and things like that. There's crackles. You explain it to yourself, let it make sense to you. Maybe when you hear things in your own words, it's easier for it to stick. And guess the advantage of that. When you're driving to work, instead of jamming to that favorite song by Beyonce or something that you like to do, you can press play on your voice recorder and listen to it on your way to work instead. Again, you are at work at night, you can put in your earpods and listen to it again. When you have something constantly in your mind, in your ears, you're hearing it over and over again, you'll be amazed at how much your brain can retain. All right, take advantage of this things. You go for a doctor's appointment, they're wasting your time, plug in your earpods. All right, listen to something that you've recorded before. Okay, this is you learning doubly because you were the one who recorded it, and now you're hearing it play to yourself again. Number 6, you need to take practice exams and read the rationales to the exams. Why is this important? Say you've done the work by studying, you have flashcards, you have audios, you have so many other tips you're using to study, but you won't know that you've gotten something until you actually apply it. It's not enough, like I said earlier, to acquire knowledge. You actually need to apply it. Because what's the point of knowing things just in your head, but you can't effectively apply it? And that's what's going to happen when you go to that class on Monday or Wednesday, whenever your class is, and you need to take your exam. And then you're like, I read this thing, but now I can't really apply it. All right, don't wait till you get to the exam. Or you yourself quiz yourself. And you might say, where do I find practice exams? Where do I find these things? All right, while your school might not provide you with like resources to practice exams, if they do not, you can go outsource. You can purchase these things yourself. All right, so we have so many textbooks out there. You can get one like this. Essay is called the Comprehensive Review of the NCLEX PN Examination. You can get the one for the RN. This is a book you can get if you're not studying for PN. You can get the one for RN, which is for registered nurse. That's just one by Essay. All right, you can get Saunders. All right, there's Saunders resource, there's Kaplan, there's so many resources out there, and all of them always have these practice exams that you can study. Oftentimes you might have to put it on your E.L.V.A account. Hopefully your school uses E.L.V.A. If they don't, you can create one yourself. It does not have to be associated with your school. Once you purchase the book, they will guide you on how to get to the resources. There's so many resources out there. I'm pretty sure there's some free ones. You just gotta search. All right, the advantage of that is you get to practice some questions in particular to whatever you're studying for, and please, 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 I always tell my students this: when you practice exam, it's not enough for you to just practice the exam. Read the rationales. What are the rationales? The rationale is telling you this is why this answer was correct, and this is why this answer was not correct. What are you doing by doing that? You're studying. You're learning that, oh, okay, this is how I should have taught. It's upping your critical thinking skills. Our seventh strategy is do case studies also. All right, case studies are really good because they are different from just your select option A, B, C, and D. They require you to actually think. All right. So critical thinking is so important, especially with the next generation NCLEX coming out. You need to sharpen your critical thinking skill. When you read something, normal heart rate is 60 to 100 beats per minute. That is good. But when it comes to nursing, we don't just want to know raw information. We need to be able to apply it to situations. Right? You need to now get a case study that gives you a particular scenario, and you need to apply that knowledge to it. Very important. I'm going to give you a bonus tip. You need to study for the long haul. I know a lot of you just want to pass that next exam. You just want to pass that next quiz. Move on to the next class. But you guys need to remember that when you're done with nursing school, you're not really done yet. All right, you got to pass the NCLEX to become a nurse. What's the point of passing nursing school and you don't pass the NCLEX and get licensed to practice as a nurse? So when you're studying, all those flashcards, those recordings, keep them because you're going to need them again. And when you study like, I want to study knowing that this is not just what I need to study for. This same content is still what I'm going to need when I'm studying for the NCLEX. So I'm studying long term, not just for that next exam, not just for that next quiz, and not just for the NCLEX too, but for my entire career as a nurse. Even when I pass the NCLEX, I still need this knowledge to take care of my patients. All right. So as a nurse, we are long-term, lifelong learners. We don't just learn for short-term periods and we forget whatever we're learning. You need to start learning like your life depends on it, literally, because you need updated knowledge to take care of your patient every time. So I really hope that these tips are going to help you to get better when you study for your exams, and I look forward to hearing from you how this were able to help you. And before I go, I want you to know that if you need extra help with getting a particular concept or topic that you're training in nursing school but you're struggling with it, I offer nursing tutoring sections. You can definitely schedule one with me. Please contact me with the information in the description box and I will schedule a time with you. Thank you so much for today. Please comment, like, share, and definitely make sure you subscribe to this channel so that you do not miss a bit. Thank you. Bye.